Go get him, Code.
On October 10th, 2011, we decided we were going to take our horses to the beach and have an impromptu little photo shoot. While we were trying to get them on the trailer, Cody's horse, Gamble, shied away and he ended up being stung by a bee. As he ran away, he pulled the rope out of Cody's hands and he kicked backwards, and Cody was behind, so it got him in the face. He actually got up, he went to the stairs, sat down, and as I'm talking to the 911 operator, she's telling me to have him sit. But he got up and went and got himself a drink, and then he went in the bathroom and he looked in the mirror, and that's where the rescue had to come in and try to help him. He was taken to the hospital and then they transferred him to Boston, and that's where we met Dr. Kraus.
So when I first met Cody, he wasn't conscious. The helicopter had brought him in from New Hampshire. He's one of the best horseback riders in New Hampshire. I met his parents before we took him to the operating room. His procedure was complicated in the sense that he had an open fracture, a large laceration that extended across the face from the horse kick. But also there was a component of an orbital fracture, the fracture of the eye socket that was actually riding adjacent to the eyeball itself. So that was a major concern. The procedure took us about 6 hours to do, and after the procedure we were able to successfully have a good result. A few months later, we did a scar revision for him. That scar revision was to move a portion of the upper lip and release it so that it actually sat in a normal position. It also released the nostril so that the nostril is sitting in the normal position after the scar tissue contracture.
Cody wanted to keep some of his scar because his dad likes to say that scars are like tattoos with better stories. So he did not want to get rid of all of the scar because that is part of his history, part of his story. He does have a little bit of the scar, but it's hardly even noticeable. So Dr. Kraus did an amazing job taking that scar and reducing it greatly so it was not a prominent feature on his face and doesn't take away from his good looks.
Cody's been happy. He's grown up to be an amazing horseback rider. He's out in Wyoming now. He has a great family, and I'm very happy with how he's moved along.
So Cody is now 21 and he is now in Wyoming. He is interning on a ranch, becoming a horse trainer. That was his dream. He still has his love for horses. And so on the ranch, he's learning how to train colts and fillies and get them ready to be sold. So for the doctors at this practice, Dr. Kraus, you have meant everything to our family. The care you took of our son, the care you took of our family, because this wasn't just Cody he took care of. He took care of all of us. He gave us our peace of mind of knowing our child was being taken care of. He gave Cody's siblings the same thing. You know what I mean? They knew that there was nothing to worry about. And you took such good care of him, and you gave us our son back. And we are forever grateful for what you did in taking care of him, and that Cody is who Cody is, partly because of that.